Welcome everyone. The COVID-19 pandemic was a global shock unparalleled in living memory. In the panic that ensued its arrival in Europe, the pandemic exposed the tension between a collective problem and the impetus to adopt local solutions. Yet, the EU has reinvented itself, and it has shown that it was in everyone's best interest to work together to overcome the pandemic. To tell us how the EU turned this crisis into an opportunity, we have with us Anna Kyriazi, who is a researcher at the University of Milan. Hi, Anna. So when the pandemic arrived in Europe in early 2022, there was chaos and confusion with member states hoarding medicines, shutting down borders, acting isolated. How did the EU adapt its response over time to become the head of a coordinated health response?
Hi, Luis. Thanks for the question. Indeed, we all remember the first reaction to the pandemic, which was very fragmented and very chaotic. Of course, this was an unprecedented situation. So member states acted unilaterally. There was, as you described, hoarding of medicine, medical equipment, and so on. But EU response increasingly found its way. This problem was one that really inherently doesn't know borders, right? So viruses don't care about the borders of Austria with Hungary. It is, by definition, a kind of problem that needs a cross-border collective solution. At the same time, in the EU, the policy of health, healthcare and public health as well, is something that is very much in the hands of the member states. The EU has some power in public health, but it's not that much. And in fact, the framework that was in place, for instances such as the pandemic, obviously had major problems. Maybe it's useful to distinguish a little bit between health and healthcare and public health. So healthcare is when you go to the hospital, you see your doctor, right? And then public health is more concerned with the general health of the population. So it involves prevention, it involves research, and it also involves kind of responding to communicable diseases, such as was the case with the pandemic. So the EU had some powers in this, but they were very, very limited. After the kind of first, as you describe, a bit of a chaotic response, the EU came up with some ad hoc solutions first, and then in a second place, it tried to codify these solutions. So it took some important reforms. It reformed the way that, for example, surveillance works, so just to know what is happening. It reformed the way that the warning system works, so we know that there is a threat. It reformed the kind of overall architecture of how the EU can respond to these things, taking medical countermeasures, procurement of vaccines, and so on. We can discuss this a little bit later. So the way that the EU did that is actually really interesting, and we have explored this in a paper with Maurizio Ferreira and my colleague Joan Miró about the birth of the European Health Union. So basically, what we see here is not centralization. It's not like the EU or the Commission gets the power to act, in health, in public health. Of course, its powers are expanded, but this is done in a very cautious way, in which basically the member states also retain kind of their power. So it's more like a collaboration. It's more like a positive sum expansion. For example, the Commission now gets the power to declare a public health emergency at EU level. But they cannot just do this, out of nowhere. It has to get authorized by the member states. So this is what we are talking about when we talk about the positive sum expansion of power. It's not about centralization in this sense.
So talking about expansion of power, and you also mentioned vaccines in your response. So in your opinion, was the vaccine procurement procedure a turning point for the birth of a European health union?
So I don't know if it was a turning point as such, but it was very important. And again, we can recall maybe that the beginning was a little bit bumpy, but then it actually is perceived now as a success story, the vaccination campaign, including the joint procurement. So this basically means that member states come together and they purchase together this very important this very important product, right, which is the vaccines. And so this was especially a solidaristic response on the part of the EU, because if you think about it, large member states have the power to go and negotiate and get their own vaccines, but the smaller member states will fall behind. So the joint procurement of vaccines avoided this. It was a solidaristic response in which every European citizen had access to the vaccines at the same time. This was a colossal operation. So from making sure that the vaccines will be done, to making sure that they are authorized, to making sure that they are rolled out. Then we had the COVID certificate, so it was, people who were vaccinated could actually move around. Mm-hmm. So this was really an important operation on the part of the EU.
I see you tend to emphasize a coordinated response that encompasses member states in the Union. Interestingly, in contrast to the United States, the EU has a much more decentralized governance structure. Do you think this helped or undermined the way in which the EU was able to craft compromises?
I think it helped. So my colleagues did some work on this, and they published a paper about the paradoxical strength of weakness. So the EU, as a kind of, if you want to think about it as a federal polity, is actually quite weak. If you compare it to a proper federation like the United States, where the federal government is very powerful. Now, what happened is that actually the overall crisis response of the EU compared to the US was quite effective, and it was much less conflictual, because in the federations like the US specifically, you have the states and the federal center kind of competing with each other. So there was this kind of a bit of a free riding on the strength of the polity, because everybody, of course, takes for granted that the US will exist. Now with the EU, exactly because you don't have this certainty, at some point when things seem to be coming down, the member states actually have incentives to maintain the polity. So they come together to protect it.
So you believe that the contested nature of the EU helped in, many people say that in terms of how crisis contributes to the consolidation of an European response, the pandemic crisis was arguably one of the Union's least bad crises, to the extent that it is seen to have weathered the crisis well. Do you think, what are the lessons that the EU has learned from the pandemic, and more importantly, do you think that it is prepared to address future pandemics?
It's better prepared. We should also stress that, of course, COVID has involved a catastrophic loss of life, and in this sense, we are not talking about good crisis in this sense, of course. But it is better prepared. It has some better tools. We mentioned, monitoring. We mentioned joint procurement mechanisms and so on. Somebody may tell you that this was perhaps a bit of a lost opportunity given the magnitude of the shock. So actually change has been quite incremental, at least on the health part. Mm-hmm. NGEU, for example, was very path-breaking, but in a bit of a different domain. If you compare it to other crises, if you compare it to the migration crisis, for example, definitely COVID has been one of the better ones in this sense. I should also mention that my colleagues have written an entire book about the COVID crisis, Pandemic Polity. Is its title, and there you can find much more about this.
Anna, thank you so much for this exciting conversation. What about you? Do you think the EU handled the pandemic crisis well? Do you think that its powers should be enhanced in the realm of health policy? Let us know. Share your thoughts on our Blue Sky profile or in our website, where you can check all our papers in open access. Thank you very much.